what is the purpose of engaged care talent? Because often we say on the podcast when we do the episodes is we're all about solving the care talent crisis one conversation at a time. So what does that actually mean?
Well, I'll read you what we did previously and let's see if it's still relevant.
Yeah,
So
yeah.
Engaged Care Talent is a community for anyone passionate about transforming the care sector.
Yeah.
Relevant. We share opinions and experiences on how employers can attract and retain talent in innovative ways.
Nice.
We don't mention about engaging talent, and we retain. All right, that's a question for me. Together we aim to contribute to solving the care crisis through meaningful conversations, collaboration and action. I think that is all relevant, although I would actually add in there about engaging people because attracting people into the sector, definitely. Retaining top talent in the sector, definitely. But engaging and getting great performance and oh man, I'm going to go off on one because you could have supporting people.
Yeah.
Because people need to be supported.
Yeah.
In healthcare.
Massively, and I think that's unpacking the retain bit, isn't it? Retaining talent, which is there's things that organisations need to do to be able to ensure that the sector, or health and social care sectors, are full of people that are loving what they do. Yes, they face challenges, but they are passionate about what they do, and they feel that they are getting the tools that they need to do a great job, and ultimately service the health of the nation.
And it says it in there because we're basically trying to help contribute to solving the care crisis through actually bringing those conversations onto a platform that has no hidden agenda or some weird thing underlining it. It's just straight talking. It's honest,
exactly,
and real. So yeah, I think that is absolutely relevant.
This is not a vanity project for us. We are passionate enough to believe that we have a profile that we need to raise in the sector, and we are passionate to feel that we are the people who can incite change in health and social care. But it is about giving individuals a platform to share their experiences. It's like with Raf, put it under the episode called Healthcare Innovators, because of what he's done to change things in his organisation and in his specialism. So I think it's got to be about that.
Yeah, I agree. Let's have a look at values. So we landed on 3 when we gave birth to this project. So we can change health and social care for the better if we do this. We love talking to people who are passionate about innovating. We give people the platform to share knowledge and collaborate. So I don't think that's changed. And I don't think that's changed. I think that we don't really mention about creating a community.
No.
Which I think is missing from health and social care, and I think is a massive opportunity for us as a business because that's valuable.
So then what we say is we give people the platform and community to share knowledge and collaborate.
Oh, can we put real in front of community as well?
Yeah.
Because there are
I'm going to put that in. I'm going to put that in big letters.
We've got this, and it's like
it's not. It's not. It's just a sales tool.
Yeah, we love it.
And in terms of audience, this could so easily be, and we've said this before, but it could so easily be just for people in talent and attraction in health and social care. But it's not. It's anyone who's got a vested interest in attracting and engaging / retaining people in health and social care.
100%, because you will have smaller companies where you've got a brand new chief exec who's leading the growth, who's probably doing the recruitment.
Yeah.
And I'd love to think that if they're a genuinely good for the sector company with the right values and all that kind of stuff, that they're going to be able to go on to Engaged Care Talent in a year's time, go through content and go, right, I've actually got the tools that I need. I didn't have to pay for them.
Exactly.
So it's not going to compromise on the care we're going to give or how much we're going to pay our staff.
Yeah.
Man, if we could ever measure that, I think that's where we could start saying we'll actually.
Well, you know what? In a way, they measure it themselves as well, because they'll know that they've had certain conversations.
Yeah.
I can even say it with a podcast I've done my own podcast, is that I know there are some conversations I've had on my podcast that have resulted in me doing other things.
Yeah.
So, and the good thing as well is like Nathan East. Yeah. There's a perfect example, because we're not just saying it, it's brilliant. Wow, it's not just words. Nathan East has his own company.
Yeah.
and he does do lots of things because he is a small company.
Yeah.
But also, the thing about broadening out to anyone who's got a vested interest in engaging, attracting and retaining talent is that could be C-suite.
Yeah.
You know, so things like getting Sean Hagger
Yeah.
to talk about leadership.
Yeah.
It's just, it broadens, it makes it so much more interesting, you know, and actually it makes it a lot more valuable because actually people who are in talent attraction can listen to what a CEO said or a company owner said and go, oh wow, all right, so that's what I need to do to be able to get the business case to sell something in.
Yeah.
Yeah.
Likewise, it could be a team leader.
Yes,
A
exactly.
small team
Yeah.
in a care home who wants to look at ways of engaging their team, doing something that's a little bit different from the day to day.
Yeah.
Maybe we'll be able to create some resource that people will be able to tap into.
Exactly.
We do the wellness and well-being episodes, which
Yeah.
I've not mentioned to you yet, but we'll do.
Well, actually, and like so there's this thing about, so when Sean Hagger was talking about the challenge with leadership is that no one's taught to become leaders.
Yeah.
They just progress in companies because they're good at what they do, but then they move into people management and then leadership and they don't know how to do that.
Yeah.
So actually, this content as well can help people. In a way, it becomes like career coaching for various different levels. Because actually, for someone who wants to be in a leadership role, they can listen to, or they can already go to the platform, engagecaretalent.com, by the way, for anyone who's listening. But they can go to the website and there's an episode there that is someone talking about leadership.
Yeah, exactly.
So, like, we're already doing it, man,
Yeah.
which is like fantastic.
That's cool. I don't think we need to talk about the competitors bit on there because
No.
they are not competitors.
No, and we're actually, so there's
I don't think there's anyone who's
do you know there's like, have you heard of like Blue Ocean and Red Ocean?
No.
So Blue Ocean is so Red Ocean is where there's lots and lots of sharks in the sea competing for the same thing. So of course the ocean is red. Blue Ocean is where you are in a category that has no or very few competitors.
Yeah.
So it's a much nicer environment to be in, and you can, you know, be that big fish or one of the big fish in that pond.
Yeah.
So I think you're right. There's not, because we have looked at this before, haven't we? It's like, is there anyone doing this? I think the closest we can see to this is with people who are maybe doing webinars. We saw there was an ATS. I've never seen the ATS before, but they did a thought leadership piece, which was a PDF, you know, about tackling the challenges facing healthcare. But typically it's webinars, you know, and it's using ChatGPT, you know. So, is anyone doing a documentary right now, or has done a documentary about their podcast, about their company? I haven't seen it.
Not yet, no. So,
but the thing is, they don't do it because they don't see the business case for it. The good thing is we are convincing ourselves. We are. It's our business. It's our time, and we can decide what to do, which is fantastic. And we know this is the right thing to do, which is why we are doing. Also, why are we doing this right now? Why are we doing a planning session? But it's like, well, no, Jonathan. It's like we've worked with Jonathan before. We're in the studio. Let's spend some of the 2 days turning it into documentary because that's what it's all about. We're very much like, it is this thing about building in public. You know, and we want people to be part of that growth and that building of engaged care talent.
Yeah, definitely.
Oh, awesome. Pumped, man. Sweet. Coffee time.
Yeah, good.
So that can cover our costs.
Yeah.
So,
Man United champions, that's all.